As our population grows older, care for the elderly has become a hospital priority. This film has been made to explain the typical itinerary for elderly patients as they proceed through the various healthcare sectors. This film addresses both patients and their loved ones.
I'll just button your sleeve before going on to the admissions procedure with your daughter. After that, you can both see the doctor.
So, Mr. Favre, you fell down this morning.
Yes, I don't know. Everything went foggy. The kitchen table fell on me. I fell down. I tried to steady myself. I really hurt my knee.
When an elderly patient arrives at the emergency ward, he is seen by a geriatric doctor. During this initial consultation, the doctor will perform a full medical checkup as well as doing a special geriatric assessment.
Do you remember what time it happened?
Well, it happened this morning.
It must have been around 8 o'clock because I had to be at work at 8:30 and...
The goal is to determine the patient's level of independence and to get to know his family circle.
Very good. Now we're going to X-ray your lungs, pelvis and knee.
Ailments manifest themselves differently as we grow older. The elderly often have multiple pathologies. Specialized care is often necessary.
Your knee is not fractured, which is reassuring. But on the other hand, I'm rather worried because there is pneumonia situated in the lower right part of your lung. Not only does this affect your memory, which isn't working as well as it should, but your diabetes is causing you problems as well. We're going to have to send you to a geriatric hospital.
But I just came because of my knee. Go to the geriatric hospital. I don't belong there.
I think you'll be well taken care of there, and I will certainly feel better. I'll come to see you every day at noon. We can lunch together.
Yeah.
I'll come with you. I can take care of you. And the people there are nice.
Okay, let's try.
An initial health assessment is carried out when the patient arrives at the emergency ward. If the problem can be quickly dealt with and the patient's state of health allows, he will be able to return home. However, if the patient needs to be operated on, he will be hospitalized in a surgery unit.
Are you comfortable, sir?
Yes.
Not too warm?
No.
Not too cold?
If hospitalization is required, the patient may be transferred to a geriatric service.
Hello.
Hi.
Hello. Is this for admission?
Yes, this is Mr. Favre.
Mr. Favre.
1932. The emergency ward sent him.
Okay. Hello, sir.
Hello.
My name is Christine. I'll be registering you and helping you settle in.
Hello, Christine.
Hello.
I'm his daughter.
We're going to put you in a temporary room for a few hours.
1, 2, 3. There you go. You okay?
Yes.
They'll help you get settled comfortably right away. Can I leave you his file?
Okay.
Thank you. I have to say goodbye, Mr. Favre.
Goodbye, and thank you very much.
You're welcome. Take care of yourself.
You're very sweet.
I hope you get well soon.
I'm going to record your heart. Do you know this test?
Okay. No, I don't.
No? I place these little patches. There.
Perhaps someone should tell my daughter because she will be worried if she doesn't find me at home.
Listen, Mr. Favre, your daughter brought you to the emergency ward this morning.
Oh, really?
Yes. She's just gone for a short time. She went to pick up a few things at your home, toiletries and some clothes. She'll be back. But if you're really worried, I can get her on the phone. We can call her.
No, I'll be fine.
Is okay?
Yes.
You feel reassured? I'm going to call the resident physician who will come to discuss some things with you. Then you'll meet the chief resident. Just push the little red cross if you need anything. Please don't hesitate using it.
The doctor examines the patient and does a few tests to evaluate his level of autonomy.
I would like you to begin at 100 and subtract 7 each time. But you have to do it alone.
100 minus 7, 93.
Good. Minus 7. It's fine. We can stop now. I would like you to take a little test. It's not always easy. I'd like you to draw a clock, a nice clock with numbers on it, and the hands pointing to 11:10.
11:10.
Okay, we'll leave that for now.
The patient then meets the chief resident of the geriatric clinic.
Now we'll take you to your regular room, a double room. It doesn't have a view of the lake, but it's rather nice.
Together, they decide upon treatment and a series of examinations and then inform the patient.
Hello.
Hello.
Mr. Favre?
Yes.
Hello, sir. Madam?
During their stay at the hospital, each patient is cared for by a multidisciplinary team of doctors, nurses, physiotherapists, dietitians, occupational therapists, social workers, and other professionals, depending on the patient's needs.
How do you feel today?
A little lost. I'm moving around a lot.
This is a normal reaction. You've been moved from place to place and have been dealing with a lot of people asking you a lot of questions. It can be very tiring.
Nice soup.
Yes.
A dietitian begins working with the patient as soon as he arrives. The patient is suffering from malnutrition, which is quite often the case with the elderly.
You haven't eaten much, huh?
It was good, but there was too much.
What do you like to eat?
I like fish.
Physiotherapy is used to enable the patient to remain as independent as possible. An appropriate program with specific objectives is established according to the patient's age and physical capacity.
When you walk, you must always place your foot firmly towards the back of the step.
Okay.
It should never be placed on the edge. Here, these are trolley tracks. This is like walking through a construction site. And this is a hardwood floor, a carpet. Oops, watch out. There, now it's soft. This was set up to surprise you. Very good. Excellent.
Elderly patients are vulnerable. They tend to develop complications more rapidly and more severely than others. Specialized medical care is adapted to their age and capacity. Mr. Favre hadn't left his home for several weeks for fear of getting lost. The medical care team discovered his memory problem and informed the analyst. A neuropsychologist performs a series of tests as the final phase in the assessment process.
Can you tell me which of these 4 words is a profession?
I think it's the plumber.
Very good. The fruit?
Or the apricot.
Exactly. And the musical instrument?
The clarinet.
Right. Now, I'll hide them from you. Can you tell me which word among the 4 was the profession?
The plumber?
Yes, exactly. Very good. The fruit.
It's confusing.
I want to talk a little about your hospitalization and discuss the memory tests you took last week. How did they go?
The test, yes, some of them were fun. I passed some of them and then, well, I think I did, but some others were not, and they didn't go well.
And do you feel that the tests, which were difficult for you, is that normal or is there something wrong?
It's just age. You have an old dad. It's not that serious.
Do you know why you're experiencing memory loss?
No, not...
But yes, look. Remember Aunt Huguette?
Oh, no, wait a minute.
Yes, you do. She has Alzheimer's.
Aunt Huguette can't remember a thing. She's completely... I don't know. No, I'm not like that. I remember a lot of things. You, what you said yesterday, what you said today. No.
The tests we did, as you've said, there were two kinds of tests. On the one hand, there's the scanner that helps us discover the causes of memory loss. A stroke, for example. Your scan came out very well. On the other hand, we conducted a series of neurophysiological tests, as they're called, which explore numerous aspects of the memory. And there we found that you are deficient in some areas, a little more than normal for your age. This memory loss suggests the beginning of Alzheimer's disease. What do you think?
I didn't think it was that serious.
You should begin drug treatment to counter the memory loss. But we should also discuss what you can do along with the drugs to help you. We need to see what you're able to do alone in your daily life, at home. How we can help you avoid forgetting things. For example, you can begin jotting things down in a notebook.
It is impossible to know how a particular case of Alzheimer's will evolve because each patient is different. Nonetheless, treatments exist that can help reinforce one's memory. After several weeks at the geriatric hospital, the patient has recovered from his pneumonia and his diabetes has been stabilized.
Did you sleep well?
No, and I'm pretty upset.
Well, what do you mean?
It was very noisy last night.
Was it?
I couldn't get to sleep and it didn't stop. Someone was yelling.
You're cross.
The hallway. Oh, yes, it was...
Well, yes, there was a lot of noise, yeah.
Yeah, way too much.
Otherwise, you okay?
Yes.
Did your daughter come yesterday?
Yesterday evening, yes.
Ah, she came.
Yes.
Okay.
It was such a pleasure.
Okay, I'm going to check your vital signs. Here, I'll just prick your finger.
Oh, that hurts a little.
There. Yes. You're at 5.3. You're doing well. The infection upset your system. You fell. You also changed where you live.
Hello? Oh, it's you. This evening? Oh, that's nice of you. Yes, of course, I'm pleased.
The patient's condition is regularly re-evaluated by the multidisciplinary team, which establishes the goals to be attained before he leaves.
You've been here approximately 3 weeks. We've treated your pneumonia, discussed your memory loss, begun a treatment which is doing well, but as we've already said, we see that you're not strong enough yet to return home. We wonder if you shouldn't be transferred to a continuing care hospital, one with a slightly less medical connotation, but where you can stay for a longer period of time to help you get in shape before going home.
I'm not ready to go home.
Yes, it's probably a bit early, but the idea behind this transfer is to help you do it. I'm not 100% sure it'll work, but we'll do our best.
If the patient's state of health and level of autonomy are good enough to allow a return home, then this will be organized and the patient will go home directly from the hospital. However, if the patient is not autonomous enough to allow him to live alone, even with the help of his loved ones and the various home care services, then transfer to a continuing care service will be proposed. Transfer to a new service is always a delicate process. The family should be involved as much as possible. If a patient needs to be transferred, it is carefully done so that he will receive the best care possible in spite of any inconvenience involved.
With a lovely view of the garden.
White birches, I love them.
And this is it.
Nice, huh?
Yes.
The health workers take the patient's personal belongings and fill out the admissions form.
You can visit anytime. The hospital is open every day until 10 p.m.
A patient will stay anywhere from a few weeks to a few months in the awaiting nursing home placement unit. If his level of dependency requires overall full-time care, then he may be placed in a medical establishment. A social worker can help the family find such an establishment for the patient. Patients participate in group activities on a regular basis.
Can we take them to our room when we're done?
Oh, yes, of course.
Is it nice?
Oh, it's lovely. It's your own personal style.
The hospital organises numerous activities.
Hello, Mr. Favre. Your nurses asked me to speak with you about your diabetes. Do you remember that when you were in hospital, your diabetes wasn't completely under control?
Yes.
Because you had an infection. We've noticed that your blood sugar levels are on the rise. We wonder if you've been eating more sweets.
I ate chocolate, but I was told I could.
Well, yes, a reasonable amount. Do you eat it in the afternoon? Do you eat...
Yes, but... Okay, yes, and it helps me pass the time. It's a real pleasure.
Okay. Now that your daughter is here, I'd like to tell you both that we have found a place for you in our nursing home.
Really?
Yes. Do you remember visiting a nursing home together?
Don't you remember? We visited 2 or 3, and we chose the one with the room on a hill.
Yeah, yes.
With a beautiful view of the garden.
Right, it was when we went walking.
The healthcare team evaluates the patient's autonomy at each step of the way. They keep the patient and his family informed. If the evaluation allows it, the patient may return home, but only if he and his family agree. The hospital healthcare team's goal is to help the elderly patient regain as much autonomy as possible in order to live a full and independent life. However, in this case, in spite of a newly found degree of autonomy, the patient and his loved ones prefer him entering a socio-medical establishment. This choice will enable him to live without hindrance as autonomously as possible. The majority of elderly people choose this option.
There's the reception desk. The dining room is over there. Now we'll go and see your room.